Overcoming all obstacles, their sense of responsibility and medical ethics have helped them continue the fight over the course of many sleepless nights. Like her colleagues, Dr. Mai Thị Hồng Vân worked around the clock to save lives in the COVID-19 hotspots of Bắc Giang, Bắc Ninh, Phú Yên, Đồng Tháp, and Bình Dương provinces and Ho Chi Minh City.
This protective gear makes it more difficult for us to perform our duties. It is hard to communicate with patients since we are both wearing face masks. We have had to do our best to help patients learn how to breathe.
Living far from her family for nearly 2 months, Dr. Vân was among the first medical workers at COVID-19 intensive care units in Ho Chi Minh City at the time when the city was in its most critical period. Just like her colleagues, Dr. Vân felt she had more strength and motivation to continue the work after seeing patients make positive steps towards recovery.
I will never forget having to call patients' relatives to tell them they had passed away, and seeing patients recover from the virus and be discharged from hospital was an absolute joy.
The task of treating patients is the same everywhere and is a dangerous job. This time, many medical workers live far from family and were quarantined from society. Many female staff worked on the front lines even though their children and parents also needed their care.
They have had to overcome many obstacles to fulfill their responsibility at home and at the hospital. Female nurses and doctors did their best in their duties, and their efficiency is as good as their male colleagues.
Female nurses and doctors have worked continually over the last 2 years as the pandemic is yet to be stamped out in Vietnam. With ethics and a sense of responsibility, medical workers will do their utmost in the fight against COVID-19.